Pukeology podcast, where science meets your hilarious puke stories and the tips and tricks to stop that chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Pregnancy cramps? What do they really mean? And the word cramps in pregnancy can make any mama scared. But what is your body really trying to tell you? Well, today's episode of Pregnancy Pukeology Podcast, Pregnancy Cramps, episode 36, will go over all of the most common forms of pregnancy cramps by trimester and what they are actually meaning. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place No Mo Nausea Band on your baby registry for your delivery bag at Bye Bye Baby, or get it shipped for you for free in just 2 days on Amazon as a Prime vendor. And know that your little ones are always taken care of with No Mo Nausea Kids and No Mo Sleepless Nights Kids, now available at your local CVS stores. Imagine being able to put those babies and your children to bed on time. That's what the natural power of No Mo Sleepless Nights Kids does. You're also going to hear some pregnancy humor that may just make you want to pee your pants. Like you don't have to pee all the time anywhere, with hilarious puke stories, including playing footsie, to have or not to have a gallbladder, now that's the question, and bath time blues. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive this. And just know we're in these 9 months together. Today, you will learn the science behind implantation cramps, the meaning behind early pregnancy cramps, and pregnancy cramps as you get farther along in your pregnancy. And don't forget, we'll always end it with 7 awesome ways to help you reduce the pain associated with cramps naturally. In today's episode 36, what do cramps during pregnancy mean?
The science of pukeology.
The burning question is, why am I cramping and I'm pregnant? Well, during pregnancy, cramps can cause a lot of discomfort, especially in the abdominal region, and can become very scary to an expectant mother. But cramps should not raise an alarm to pregnant women because they are common, believe it or not. Cramps occur during the contraction of the uterus of the uterine muscle. And that, because it's a muscle, guys, remember that it happens continuously. So you may feel a little bit of cramping here and there. In the first trimester, cramps may be caused by implantation of the fertilized egg into the uterus and the growth of the actual uterus itself. But if you have these cramps, is what we want to call them, it could potentially in your first trimester could be a sign of a miscarriage. And obviously we don't want any of that to happen, but we also want to let you know. When someone is 36 to 37 weeks, for example, and you're still experiencing cramps, it could just be a sign of preterm labor or just labor in general. And by the way, guys, back pain in labor is a almost must have. And that's how you can actually know that you are having labor. Your uterus may cramp and contract any time during the pregnancy. It could happen because you have a full bladder, you're exercising, you have an orgasm, or an infection in the urinary tract. But here's what we're going to expect in each trimester by trimester when you get cramping. Let's first start out with the very beginning. In the beginning, that's implantation cramps, right? Are you trying to get pregnant? If you've noticed cramping and possibly small little amounts of bleeding when you think that you may be starting your period, which is about 6 to 12 days after ovulation, you may actually be pregnant. Implantation cramps occur when the fertilized egg attaches to the uterine lining. The egg needs to stick to the side walls of the uterus, so the body makes a substance called prostaglandins so that it can grip better. When you go to a trampoline park, do they give you slippery socks or allow you to have socks with no grips? No. Instead, they give you grip socks so that you can jump on the trampoline without slipping and falling all the time. Well, these socks that have grips on them are that inflammatory response of prostaglandins so that the egg doesn't slip off. Instead, it's nicely coated and grabs on to the uterine lining. Prostaglandins are associated with pain and inflammation, and they are actually the trigger of how when we take NSAIDs, called nonsteroidal anti-inflammatory drugs like aspirin, Aleve, naproxen, that's actually the substance that they are attacking to decrease inflammation. So I always tell all of my patients, please only take Tylenol if the cramps are too painful and not Advil, because again, you're just fighting your body to not get pregnant. That being said as well, there's new studies that have come out suggesting women who are trying to conceive, don't take ibuprofen, don't take naproxen for months before you're trying to get pregnant, because again, it will decrease that inflammatory response to really grab onto the egg. Cramping during the first trimester. So now, yay, congratulations, you're pregnant. And some women will start to notice that they actually may start to cramp. Yet their periods are not starting. So cramping may be caused by a quick growth of the uterus or the uterine in the first 2 trimesters. I know I personally had some really bad cramps that also kind of manifested into what's called round ligament pain because my uterus was growing so quickly and I had some really awesome rocking abs before I became a mom. And so I felt like my body was extending itself too quickly and that my body was trying to catch up. So light cramping usually occurs to most pregnant women during the first 16 weeks, and that's kind of what we were talking about before. Many women assume cramping to be a sign or a cause of miscarriage in the earlier stages, which is not necessarily the case. Miscarriages mostly happen when there is an abnormality in the development of the egg or the embryo. The cramping linked to a miscarriage is caused due to the irritation of the blood and the tissue leaving the uterus. So if there is a problem with the actual development of the egg and embryo, it immediately says abort mission. And when it does that, you have to remember that these are substances that are stuck inside the uterus. So it's trying to get it out. And so what's the way that our body expels things? By moving and cramping and moving and cramping and then ultimately discarding. So I don't want you guys to be very concerned. A lot of pregnant women during the first 16 weeks have cramping. Now, if you do see bleeding associated with it, please go see your OBGYN and or your healthcare provider because you want to make sure that your baby is growing naturally, it is growing appropriately, and then they'll be able to hear a heartbeat if the baby is still there. But again, cramps happen, guys. That's just what happens when your uterus is growing and you're not used to your uterus growing inside your body. Second trimester cramping. Now this occurs when you are least expecting cramps. And again, other discomforts in pregnancy, you usually call the second trimester your Goldilocks period because everything seems just right. Well, I'm here to tell you that's not exactly how every woman experiences pregnancy. Women pregnant with multiples are, however, mainly the ones that are having this type of cramping. It's because when they reach their third trimester is what their body is reaching. Normal women third trimester, but they get all this stuff in the second trimester. So cramping can also be due during pregnancy to mild urinary tract infections. I'm going to put a preface on urinary tract infections and not call them mild because I will give you a personal experience. I actually had during my 6th month of pregnancy the worst UTI, and unfortunately it was gone undiagnosed because I had never had a UTI before, and it actually caused me to go into preterm labor. So it is something that make sure that your healthcare provider, your OBGYN is taking your urine samples, and that's what they're checking just to make sure that nothing is out of whack. Another critical and crucial cause of cramping at this stage is called uterine fibroids. So uterine fibroids are mostly prone in African American women. They may start in the second trimester due to an insufficient blood to enhance their actual growth. Usually women who have uterine fibroids actually get a relief because it's extremely painful every time they have their period. They actually get relief during their pregnancy, but some women, again, I was stating that African American women have a higher propensity to it. They're noticing it much more during their second trimester. And that's because the uterine fibroid is ticked off, right? The baby's getting all the blood and it's not getting the blood anymore. So this kind of cramping occurs mainly between 15 to 18 weeks pregnancy. And pregnant women with these kind of cramps should always be on alert because, again, this could potentially require hospitalization to effectively manage their pain. So please keep talking to your doctor. Again, you may go see a perinatologist if this is the case. Third trimester cramping. Yay, we're getting closer to baby. So cramping at the third trimester is very common in women. Cramping often occurs in the form of Braxton Hicks contractions, which are almost very similar to contractions when you get labor. The difference is that these contractions happen, but then again, there is no baby, right? You're not dilating. So during the third trimester, you feel much pressure inside of your pelvis due to the quick growth of the baby. And sometimes those stretch receptors, if you've ever been a jogger or a runner, you know how you get that side flank pain? Well, that's because the diaphragm, which is a muscle, is kind of stretched, right? Usually it happens over on the right-hand side for runners. And again, your accessory muscles, which lie underneath of your rib cage, are literally stretched also, causing that pain. Well, think about it in the exact same way, right? You're having contractions, you're having stretching of your actual uterus itself. And so sometimes that can cause referred pain to your abdomen as well as to other parts of the body. When you experience cramps at this level and or during the third trimester, assess whether you could be having preterm labor and make sure that you seek guidance from your doctor. It is just a normal reaction to have cramps, especially because your body's like amping up. It's getting ready to serve that baby. Beautiful eviction notice. Make sure that you rest, you drink water, and help take a little sugar intake. Sometimes that will help too because of the electrolyte imbalance. This will ease cramping. We'll talk about 7 awesome ways that naturally can stop the cramps from giving you pain in the next section. So when you have sex is another. Sexual intercourse is very common causing cramping. And this happens, the uterus actually cramps in a lot of women, regardless if you're pregnant or not. You may experience these cramps after you've had an orgasm, but this should not be a concern because the cramps only last for short periods of time. Having sex while pregnant is fine. Remember that. We actually have a pregnancy Pukeology podcast dedicated sex positions in pregnancy to make you enjoy it just as much as he is. And again, go for it, guys. You can't get pregnant again, right? So having sex while you're pregnant is okay. And as long as that is okay with your doctor and that you don't have any other conditions. But please, if your water broke, do not have sex. Do not put anything up there because of the fact that it could potentially reach the baby. That's my little PSA message for this little section. Again, so you're talking about different circumstances where cramping versus non-cramping. And if you're cramping more than 5 contractions or cramps in an hour, this could be a sign of preterm labor or labor. I had both of my babies at 37 weeks. It's like my body knew that they needed to come out. So your body might be trying to tell you that as well. And listen, because sometimes if you've ever heard of those amazing stories where women are nesting is what we call it, those are the ones that I'm talking about. And when you have not confirmed that you are pregnant via an ultrasound or experiencing cramping followed by bleeding, lightheadedness, dizziness, this may be a sign, unfortunately, of an ectopic pregnancy. We actually have an entire podcast dedicated to ectopic pregnancies, and this is a form of an emergency. So you may potentially have to have emergency surgery if it's not cleared up with medication by your doctor. Having pain in your abdomen or back cramping may also be a symptom of bladder disease, kidney stone, or appendicitis. We're not going to get too far into that, but again, it is important that you know that those are the potential risks and complications during pregnancy with cramps.
Throwing up on a Tuesday? One puke story.
So one day, my husband and I were playing footsie up underneath of the dining room table, and all of a sudden, I felt my foot and trying to be sexy go up his leg. Well, I didn't know that I had a problem with my feet being rubbed, and I was 12 weeks pregnant at the time. I went to go take a bite of my delicious dinner, and my husband literally grabbed my feet and put it up next to his stomach, and the thought of my disgusting toe jam made me start vomiting all over my dinner plate. My husband has never given me a foot massage since. Thanks, TOTTYS, Tootsie, I think, for that hilarious puke story. It's incredible that you actually called your Pinterest, or excuse me, your Twitter handle that exact same thing from a traumatic story. All of a sudden, I was in my last trimester and was having horrible abdominal cramps. I didn't know what it was. It was terrible. I would get sick. I was vomiting everywhere. And all of a sudden I went to go visit my doctor. And what they found out is that my gallbladder was firing uncontrollably. So the second that he asked, would you like to have surgery to have this done and removed? Now remember, I'm pregnant. I started bawling my face off. I took my hat off and just started vomiting inside of it, inside the doctor's office. So from this day forward, I always joke, to have or not to have a gallbladder. Now that is a question. Thank you so much, Charlene, for that hilarious puke story. I definitely have to think of that a little differently when it comes to my patients. I was taking a nice, warm, incredible bath, and the only thing that stood in my way was the fact that I had a 3-year-old playing with his toys next to me. I was pregnant now during my second trimester. Everything was going great, and all of a sudden, my son went to show me his beautiful car that he was playing with, and his boogers just started dripping inside of the bathtub. I started dry heaving immediately, and I couldn't help it. I know I should have helped my son, but all of a sudden I just started puking all over my awesome bath. So now it was a bath bomb, puke bomb, and it smelled absolutely terrible. Thank you, Tanisha, for that hilarious puke story. That is what we really call bath time blues. Do you have a hilarious puke story that you just can't wait to hear? Send it to me. Pukeology, Pukeology @nomonausea.com, or tweet us at Pukeology so we can all have a good laugh.
Tips and tricks to stop the chuckle that you need.
So how to relieve cramping during pregnancy. All right, here are 7 of the most awesome ways that you can help to get rid of these cramps, because aches and pains seem to be completely overtaking your life as a pregnant woman. Take it from one prego to another. I totally understand. Number 1, take a nice warm shower or a bath. This helps to chase away the cramps. Warm showers will help to loosen up the muscles and cause a vasodilation of your vessels, meaning that you will have more blood running through your body to get needed healing cells to the area. And avoid using heating pads on your abdomen, particularly in your first trimester. Remember, hot tubs, keep it like warm, not like burning hot, just because of the fact that you can overheat very quickly, and you would never want to cause any type of brain damage to that beautiful baby inside your tummy. Number 2, stay hydrated. Drink 8 cups of water a day, because cramps are a result of electrolyte imbalance. Try eating foods that are water-rich, like cauliflower, spinach, peppers, carrots. They also provide great vitamins and minerals. So if you get super bad cramps and nothing else will work, squirt a little mustard into your mouth for a surge of potassium electrolytes, and the cramps will immediately subside. This is what they use on the athletic fields to stop athletes from having muscle cramps. Trust me, it really works, even though it tastes great. I mean, bad. Number 3, get some magnesium. The lack of magnesium in your diet can have a negative effect on your body's muscles and therefore its ability to relax. This means that your muscles will want to stay contracted or in a state of cramping if it doesn't have magnesium to let go. Talk with your doctor about switching your prenatal vitamins to one that has a higher magnesium source, or that they may want to prescribe you magnesium pills to go along with it. Remember, to get more natural sources of magnesium in your diet, eat spinach, walnuts, bananas, and dark chocolate. Yes, eat more dark chocolate, Doctor's orders. Stretch daily. Stretching helps to relax the cramp muscles, and it also is a great way to prevent cramps from occurring in the first place. Stretching is an act of lengthening your muscle fibers so that they are less able to contract and cramp once they are more flexible. Remember to stretch after physical exercise because your muscles are very vascularized, meaning that they have lots of blood flow and the muscles are nice and worn out so that they can stretch a little farther when they're warmer. Number 5, elevate your legs while you're sleeping. Bringing your legs up to the level above your heart helps to increase the blood flow back to your heart and decreases lactic acid. That is the crappy stuff that's given off by your muscles when you have a muscle cramp or soreness after you've worked out super hard. Now, this lactic acid buildup is what causes an additional cramps. Placing 1 or 2 pillows underneath your knees also helps to take the pressure off your low back. So you're getting a BOGO, a buy one, get one free relief, all from just pillows underneath your knees. Sleep. Fatigue, the lack of sleep, can cause an increase in the likelihood of muscle cramping. As a pregnant mom who used to get woken up by terrible muscle cramps in my feet, I know that they can wake you up out of a dead sleep. And I'm not a napping person, but when I was pregnant, I needed to get more uninterrupted sleep, so taking a 20-minute nap here and there really helped. Pregnant prenatal massage. A massage is good for the mind, body, and the soul. Massage increases the blood flow and gets rid of the lactic acid buildup and keeps the muscles and tendons and ligaments nice and relaxed. Loose muscles decrease their ability to cramp, and you don't have to buy a massage. You can do it yourself for your feet and legs, especially at night before you go to sleep. If you are worried about the cramps, seek the doctor's intervention if it gets too bad, but usually these 7 cramp remedies listed above will help to stop the cramps even before they start. Now that you've learned the incredible 7 awesome ways to stop cramps, and then what is your body trying to tell you during cramping, I want to make sure that you guys all know that I'm here for you. So please, if you love Pregnancy Pukeology Podcast and me, let me know with 5 stars for hearts or likes for ratings. Don't forget to download this important episode, but more importantly, share it with all your pregnant friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 36, Cramps During Pregnancy, and What Do They Mean?
Pukeology Podcast, edutainment at its finest.